Hello, my name is Dr. Chebet. I'm a physician and a heart specialist in Kenya. So sometimes a few of my patients who are generally above 60, they'll come and complain about the number of medicines that they're taking, because it seems that as they are growing older, the number of medicines also increases. Because you can have diabetes, high blood pressure, arthritis, heart failure, and so you'll be on medicine. So they usually try to get off these medicines. They try to stop it, but I usually tell them that honestly, taking those medicines might help to prolong your life, because at this point, the difference between who will have a short lifespan and who will have a longer lifespan depends on how healthy you are. And some of the medicines we give you, like heart failure medicines, they are meant to stabilize your heart so that you can be as healthy as possible. Medicines to control diabetes, so that we try and minimize the side effects of diabetes, the nerve damage to the eyes, to the kidney, to the brain, so that your life is slightly prolonged. And the difference on who makes it to, let's say, 80 years depends on how good your access to healthcare is, because we all know that in Africa the lifespan is not long compared to the developed countries where there are so many 80-year-olds, so many 70-year-olds. If you look at the population on the data in Kenya, for example, in developing countries, they're called developing countries, usually above 50, that population shrinks so much. Some of the reasons, actually, the biggest contribution is healthcare. Because we know in the West, the healthcare, most of the time, the government takes care of people. There's Medicare, there's Medicaid, which isn't the case in Kenya. In Kenya, of those who are employed, they usually have good medical insurance. But somehow, when you're younger, you don't get sick quite often, or only a few people will have illness when they're young. But generally, the younger you are, the healthier you are. Now, fast forward to retirement at the age of 60, and that will be the end of the health insurance. And many insurance companies actually will try not to insure anyone above 60. They make the premiums to be crazily high, because it's insurance. It's just how insurance is built. They want to make profit. They're not here to help you, because they're not your government. But if the government had national insurance for everybody, Medicare or Medicaid, the story would be so different, and most of our people would be coming to the hospital. The cost of care wouldn't be as high as if you're paying out of pocket, because in Kenya, if you're above 60 and you really want good medical care, either you pay from your pocket, which is very expensive, or you get an insurance policy, and the premiums are usually very crazy, because they're trying not to cover you. So that's the difference. So for the guys who can afford good care, and you get good care, it's good to stick and not leave those medicines, because it actually makes a big difference. For example, for heart failure medicines, if I start you on heart failure meds in the moment where you couldn't breathe, your legs are swollen, your quality of life is not so good. As soon as they feel good, these patients want to be off medicines. But the problem is, when you stop the medicines, they just go back. The heart just goes back to stage 3 or 4 where we started. So that's why you need to be on medicine, so that we maintain you on class 1. Class 1 means you're able to do activities of daily living. You're able to enjoy life like you don't have disease, but deep down you know that you're taking the medicine. So it's the medicines that are making you feel better. You're able to go to church, you're able to go to your chama. That's how I assess how well my patients are doing, how well my patients above 60 are doing. I just ask them, so umeanza kurudi kanisani? They're like, hey, in fact, nilikuwa Wednesday prayer, and on Sunday I'm going again. So that's usually a measure that the quality of life has improved, because the first thing to disappear is social life. If you're very sick, Your friends will stop seeing you in church. Your friends will stop seeing you in chama. They'll stop seeing you at the neighbors if there's an event at your neighbors. But you just know that the quality of life of my patient is better if, you know, the interaction comes back. The interaction comes back. They walk around. You know, they are trying to live life as it was. Usually that's how I know that my medicines are working, because they tell you now they're able to walk and just do the, you know, the general activities of life. And so be on your medicines. Don't stop your medicines unless there's a very genuine reason, like maybe your kidneys are getting affected by the medicine, your blood pressure is going too low because of the medicines, and you don't have heart failure. Because most of the time, my patients with heart failure, their BPs are, you know, low-ish, but not too low. You know, it must always be above 90. If your heart rate is okay and not in the 40s, or if your blood sugar isn't going too low, because if it starts to go too low, you start getting recurrent hypoglycemia, then we'll have to adjust the dose of medicines to go down. Otherwise, I usually tell patients, because they ask me, how long am I supposed to be on these medicines? I usually tell them indefinitely, you know, for the time being. We don't know, and we don't determine how long you live. Our job is to make your quality of life better. That's our aim, and to, you know, to make you feel better and to prevent disability and death. So make sure in this festive season you have enough of your medicines. Let's not meet in January and then you tell me, Daktari, I've been out of medicines the whole December and now your blood sugar is 30 or 40 and your blood pressure is in 200, or you come back with a stroke. No, take your medicines. Take your medicines and enjoy the festivities.